Assalamu alaikum. Hello everyone. Today we are going to discuss about laparoscopy surgical procedure and the title is Exploring Laparoscopy, Invention, Working Principle and Clinical Applications. Firstly, let's get introduced with the laparoscopy. What is the purpose of laparoscopy? It is a minimally invasive surgical procedure for abdominal and pelvic condition. It can be used to diagnose, stage or treat various conditions such as cancer, injury or reproductive problems. And it can also be used for knee problems, for like ACL injury, etc. What are the advantages? We make a small incision that facilitates diagnosis and treatment. Also, use it is used for conditions such as cancer, injury, and reproductive problem that we have already mentioned earlier. The right side image illustrates the whole laparoscopy system. Moving into the next slide, um, this is device overview. The device consists of some key components like laparoscope is the first and foremost. It is a visualization tool for the surgery that delivers images to the video monitor. And then there are other instruments like dissection tool, suturing, graspers, electrodes, clip, needle holder, scissors, etc. Some of these are reusable, or some of them are used for single use. Now, what are the outputs? It actually gives high quality monitor images, and there are other data that can be extractable from this. Historical perspective, like other devices, we know all the modern devices has evolved through several decades, and laparoscopy device is not different. There are early contributors like George Kelling and Hans Christians. They are pioneers in early procedures. They have done animal and human experimentation. Then we can see in the left side an image popped up. This is the image of the father of modern laparoscopy, Heinz Kalk. He was a German gastroenterologist. He made a groundbreaking work in 1929 by introducing forward viewing capabilities and earned the title of father of modern laparoscopy. And talking about technological progression, the integration of modern optics and imaging has actually changed the dimension of this laparoscopy system, and we will get to know more about it in the next slides. In the methodology section, we can see a block diagram of working principle of laparoscopy. Um, Actually, the surgeon needs some preoperative information to operate, to know in which part of the body they should operate. After getting that information, the surgeon and his assistant performs the laparoscopy operation, selects the laparoscopic control and laparoscope and the instruments which are needed. Then they apply it on the patient, and they see the feedback on the monitor, and each the monitor's output actually helps them to navigate and manipulate the whole procedure. In the working principle, um, in the operation, the utilization of laparoscope is actually intended for visualization, and it transmits images to the monitor. And for the operation, we need to create a workspace, and it is made by the introduction of carbon dioxide. Its purpose is to enhance visibility and the working area. Monitoring gas pressure and flow is also important here because it prevents other complications. It regulates and the regulation to avoid issues like pain or changes in vitals. Gas removal at surgery's conclusion is also important because it ensures patient comfort and prevents post-operative complications. Types and classification. Laparoscopy is classified differently based on different things. Number one, types based on purpose. It can be diagnostic laparoscopy or therapeutic laparoscopy. In diagnostic laparoscopy, we identify and diagnose abdominal and pelvic issues. In therapeutic laparoscopy, we treat conditions such as tumor removal or organ resection. Number two, types based on organs. It can be gynecological laparoscopy or organ specific laparoscopy. Mainly, in gynecological laparoscopy, we focus on female reproductive organs. And in organ specific laparoscopy, we actually focus mainly in on liver, kidney, and bladder, etc. Number three, technique based classification. It can be manual or robotic laparoscopy. In robotic laparoscopy, we utilize robotic systems for enhanced precision. In the left side, the bottom image shows the illustration of a robotic laparoscopy. User guidance. It involves several steps like preparing patient by administering anesthesia, cleaning and marking incisions, then trocar insertion, laparoscope setup, which is important because here we adjust the focus of the camera and also adjust the brightness of the high intensity light. Then we insert other instruments like scissors, Caspers, etc. Then we execute the procedure that is the main purpose, and finally we remove the instruments. Then we also remove gas, which was used to have the working space, or which was used to create the working space. Then we close the incision to make the closure of the total process. Then I have provided some of the video links at the below, and these videos actually shows how this laparoscopy procedure is performed in real world scenario. Technical specifications. There are several key specification factors like voltage, impedance, pressure, sound, magnetic strength, frame rate of the video, resolution, accuracy, etc. Voltage. It works between 100 to 240 volt, and the frequency is either 50 or 60. The pressure, it is very important in laparoscopy because we have to regulate and maintain a specific pressure of carbon dioxide to create pneumoperitoneum. That actually it is the presence of gas or air in the peritoneum, and this is a potential space in the peritoneum for medical in the peritoneum cavity for medical purposes like laparoscopy. And we have to have a specific magnetic strength to make it compatible with the MRI. So we have a magnetic strength up to 4 Tesla, and for the for the video we have to have a specific frame rate like 60 fps. Then we have a resolution that is HD 1080 pixels, and these were the technical specification that were necessary to mention. Now we have came here to talk about the safety considerations. Obviously, this device has some potential risks and complications like bleeding, infection, hernia, risk of damage, and other adverse reactions to anesthesia. And how to prevent them? To prevent, we have some strategies like maintaining sterile conditions and follow some aseptic protocols. We have to securely close incision to prevent hernia after the surgery. Then why these protocols are important? Because these ensures the patient safety and reduces the likelihood of complications and promotes standardized and effective surgical practices. Manufacturers and cost. There are several manufacturers like Olympus Corporation, Stryker Corporation, Medtronic, etc. And depending on the type and quality of the devices, their prices vary. Like Olympus Endo Eye 3D 10 millimeter video telescope's price is around 9,995 US dollars, and the Carl Swords Image One S4U camera system's price is around 12,500 US dollars. So price varies depending on the company or the quality of the device. And what is the average cost of laparoscopy in Bangladesh? Actually, the average cost is reported around 1,500 US dollars, which varies based on procedure, complexity, hospital, and surgeon fees. We have come to the conclusion part. Here we will actually talk about all the things that we have covered before. Um, in recapitulation, laparoscopy epitomizes a transformative approach to surgery, manifesting an array of benefits. Its minimally invasive techniques, marked by diminished pain, scarring, and bleeding, contribute to a swifter recovery process because we make small incisions here, so the recovery process is much faster than others. And it revolutionizes the landscape of surgical interventions. The significance of laparoscopy in modern surgery cannot be overstated, as its widespread usage and continual evolution underscore its versatility in addressing a spectrum of medical conditions within the abdominal and pelvic domains. In closing, laparoscopy emerges as a pioneering force, reshaping surgical paradigms and consistently enhancing patient outcomes across diverse medical scenarios. So these are the references that we have used to make this content. And thanks for listening to me. Goodbye.